So now, under the universal health coverage, journey, you've mentioned it's a journey and not a destination. What would you say has been the progress in as far as implementation is concerned?
Look, Kenya has committed to roll out the universal health coverage and to make it succeed. We have tried many times, and this time round, it is not going to be a trial. It is going to be action-oriented. The Ministry of Health, or rather, let me start with the Kenya in general, under the Kenya Kwanza administration, we have 5 key agenda items, starting with health, MSME, housing, digital economy, and we have agriculture. So you see, health is strategically placed even within the government itself. And from there, when we go to the Ministry of Health, the very first thing out of the commitment to ensure that there is a universal health coverage, we came out with follows that will help us, because a house without a base is very shaky. And the follows were Digital Health Act of 2023. And digital health basically is talks about interrelatability of data. When you walk from one facility to the other, we are able to have your data in the system, and you don't have to keep repeating stories, when you go to see a health practitioner or at any facility. Then we have the Social Health Insurance Financing Act of 2023, which I will delve into much later. Then we have Primary Healthcare Act of 2023.